Ever wondered what happens if ACL surgery doesn't go as planned? The potential setbacks and uncertainties can be daunting, but fear not. We'll delve into the reasons behind ACL surgery failures and uncover the essential insights to ensure your journey to recovery is a success. Hi, I'm Dr. Mark Petropoli, otherwise known as Dr. P. Got a problem with your knee? Call Dr. P. We're diving deep into the intricate world of ACL surgery and its potential challenges. We'll explore the multifaceted reasons behind ACL surgery failures. We'll cover how to recognize if your ACL surgery has failed. Plus, we'll address some common questions such as, how many times can an ACL be repaired? How many times can an ACL be reconstructed? The answers may surprise you. Lastly, discover the crucial link between early functional performance and the long-term success of ACL reconstruction, providing insights into how well you can expect to return to your pre-injury activity level. Stick around and let's get started. What happens if the ACL surgery fails? The incidence rate of ACL rupture ranges from 36.9 to 60.9 per 100,000 persons per year, leading to approximately 200,000 ACL ruptures annually in the United States alone. While historically successful with satisfactory outcomes in 75 to 97% of patients, the increasing number of ACL reconstruction procedures performed each year contributes to a rising absolute number of graft failures, highlighting the evolving challenges in achieving optimal long-term outcomes for this common knee injury. Persistent postoperative pain following ACL surgery needs thorough evaluation, as it may signify complications such as graft failure. Failed ACL surgeries can stem from diverse factors, posing complex and technically challenging scenarios for corrective treatment by the surgeon. Factors may include technical issues from the primary ACL surgery itself. The primary cause for ACL surgery failure often stems from technical issues, notably malposition of the sockets and tunnels, especially on the femoral or the quote-unquote thigh bone side, as achieving the precise positioning can be challenging. Meniscal tears. After initial ACL surgery, the meniscus may not have healed properly, and certain lesions like meniscal root tears or so-called quote-unquote ramp lesions can be overlooked during the procedure. These lesions, which are challenging to detect on MRI, particularly if not specifically examined during ACL surgery, may lead to rotational instability and increased stress on the ACL graft, potentially resulting in graft failure. Root tears of the lateral meniscus, frequently overlooked unless specifically probed for during surgery, can exert significant forces on the ACL graft, potentially resulting in rotational instability and graft failure. Alignment, varus or bow-legged, or valgus or knock-kneed malalignment, whether stemming from inherent physiologic factors, unsuccessful meniscal surgery, or cartilage issues, imposes stress on the ACL graft as well. This strain can compromise the stability and integrity of the reconstructed ligament, potentially leading to persistent symptoms and the need for further intervention. An excessive tibial slope on the shin bone, so the top of the shin bone, if it's angled a certain way, can significantly elevate the risk of early ACL reconstruction failure by inducing a forward movement of the tibia, the shin bone, and a backward displacement of the femur, the thigh bone, and that exerts a considerable stress on the ACL. The extent of that tibial slope directly correlates with the likelihood of graft failure, with a greater slope amplifying the strain on the ligament. The problem is, in order to correct the tibial slope, the bone would have to be broken and re-angled, so to speak, in order to correct it in and of itself, which can cause complications. So it is rarely done on the initial surgery or the primary surgery. Now, how will you know if your ACL has failed? If you've undergone ACL reconstruction and are concerned about the success of the surgery, here are some indicators that may suggest a potential issue. Instability. If you continue to experience a sense of instability or a feeling that your knee is giving way or buckling, it could be a sign that the surgery did not adequately restore your stability. Pain. Unresolved pain and swelling in the knee, especially beyond the expected recovery period, may indicate an issue. This could be due to problems such as graft failure or other complications. Stiffness. Stiffness is probably the #1 complication following ACL surgery, occurring in a range of 5.5% to 24%. Difficulty achieving a full range of motion in the knee or persistent stiffness might suggest that the surgical outcome is not optimal. How many times can an ACL be repaired or reconstructed? This is a great question, and as far as repair goes, usually we only get one shot. But with the BEAR surgery, the new Bridge Enhanced ACL Restoration or repair surgery, that may actually be changing. Having said that, historically, we've only had one shot at repair. As far as the number of times an ACL can be reconstructed, that is not strictly limited. When I was doing my sports medicine orthopedic fellowship with the GOAT, the greatest of all time sports medicine orthopedic surgeon, Dr. James Andrews, I saw patients from all over the world that came to see Dr. Andrews for their second, third, and I even saw some who were coming in to see him for their fourth ACL reconstruction or revision surgery. So decisions on revision surgery depend on various factors and oftentimes require some additional augmentation or stabilization techniques, especially in young females who tend to have much more laxity or looseness to their knees than the rest of the population. Factors such as the specific circumstances of the initial failure, the patient's overall health, and the condition of the knee joint guide the orthopedic surgeon in choosing between a single revision or a 2 or multiple stage revision for optimal outcomes in ACL reconstruction failure. So sometimes to revise the ACL, that needs more than one surgery just to do that. This individualized approach allows surgeons to tailor the treatment plan to the unique needs and challenges of each patient's case. How many years does an ACL repair or reconstruction last? Studies have shown that the functional performance of an individual 6 months post-ACL reconstruction serves as a valuable predictor for their ability to return to the same pre-injury activity level at both the 12 and 24 months post-op surgery. This suggests that assessing functional capabilities at the 6-month mark can offer insights into the long-term success of the ACL reconstruction or repair in facilitating a return to previous levels of activity. Some studies have shown that patients who underwent ACL reconstruction had stable knees after 15 or 20 years and or even longer. In other words, for the rest of their lives. And if it's a repair and it heals and or a reconstruction and it revascularizes, then it should last a lifetime, unless it's re-injured, which is certainly a possibility. Our commitment to your well-being drives us to consistently invest in cutting-edge technology and advanced techniques, from state-of-the-art ultrasound, digital x-ray, and comfortable, non-claustrophobic, open MRI equipment to employing minimally invasive arthroscopic surgery methods. Our focus is on delivering treatments that are not only at the forefront of medical innovation, but also prioritize your safety. This dedication to innovation translates into shorter recovery times, reduced discomfort, and minimal scarring, ultimately empowering thousands to regain a productive, pain-free lifestyle through our progressive, we like to call, holistic team healthcare approach. That is WHOLE-ISTIC. I learned that back in 1997-98 from Dr. Andrews and his team and have carried that forward, refined and advanced that over the last 25 plus years. So in summary, we delved into the complexities of ACL surgery and what happens when it doesn't go as planned. From technical issues in the primary surgery to often overlooked factors like meniscal tears and alignment problems, failed ACL surgeries present surgeons with intricate challenges. Recognizing signs of failure is crucial. Persistent instability, unresolved pain, and stiffness are key indicators that your surgery might need a closer look. And if you're wondering about the possibility of multiple ACL surgeries, in other words, revisions, it's not strictly limited, but decisions are tailored to individual circumstances. Lastly, we explored the fascinating link between early functional performance and the potential for a successful return to pre-injury activity levels even after 15 or 20 years. Curious about alternative treatments for knee injuries? We'll unravel the world of regenerative therapy. Don't miss out on unlocking the secrets to cutting-edge treatments for optimal joint health. Subscribe now and join us on the journey.